Welcome to today's presentation, Real-Time Surgical Implant Tracking. In a collaborative partnership between RANSolve and SimplifyOR, we both want to thank you for taking time to attend this webinar. I'm Rafael Rodriguez with RANSolve Health Revenue Cycle Management. Today, we'll be addressing and looking at a new way to manage your implant revenue cycle process by increasing implant charge capture for patient billing, by increasing implant vendor contract compliance, by establishing interoperability between your charge master, item master, and implant vendor contracts, by reducing time auditing implant billing records, and by reducing time involved with clinical and supply chain documentation. At the end of the webinar, if you have any additional questions, or if you would like additional information regarding our revenue cycle management services, please contact us at www.ransolve.com or www.simplifyor.com. We will reach out to you with additional details and information and/or setting up an on-site or virtual product demonstration at that point. At this time, I would now like to introduce SimplifyOR's presenter, Jim Furch.
Hey, thanks, Rafael. Yeah, today I want to go over briefly the SimplifyOR platform. SimplifyOR was grown out of the disjointed and disconnected problems associated with implant documentation for surgery centers and hospitals. So I want to provide a couple of slide decks and sandwiched in between them, just a brief demo of the application. So let's go ahead and get started. Revenue cycle management is successfully capturing revenue at the point of use is becoming more mainstream. Due to the disjointed enterprise-wide systems, we have EMRs not connected to ERPs or material systems, which are seldom connected to implant vendor contracts. And then we have the compliance issues that everybody's familiar with: patient billing revenue, implant contract issues, and transparency and visibility into those cases. The disjointed enterprise-wide systems, your Epics, your Cerners, your Lawsons, your Meditechs, and then your implant vendor contracts. These are just a couple of the pain points that everybody has daily, whether you're a patient financial services director, a supply chain director, a charge nurse or circulating nurse, VP of surgical services, CEO, CFO. There's just not any connectivity today between these platforms. SimplifyOR set out and solved this problem. Issues impacted disjointed systems and implant revenue cycle management. Huge impact revenue misses can be attributed to manual documentation processes. Implant contracts, manual PO creations attribute to overpaying for implanted devices. Non-compliant overpayment of implant vendor invoices leads to negative PPV, and nobody wants that. In today's environment, we're all looking for transparency, accuracy in our clinical and supply chain documentation. And what is interoperability? So in today's world, we're picking up the phone, we're calling patient financial services for charge numbers. The circulating nurse is calling back the rep because of some information that's missing on the write-up, or she's not sure what's on the write-up. Charge nurses are tasked today with searching their charge master to find the right charge number for that implanted device. Does that charge amount really equal the hospital's rules relative to how much that implant should be charged? And then supply chain on the back end is tasked with, checking each implant write-up as it comes over to that person in the supply chain relative to the contract cost. Is it on the contract? Is it in the item master file? And then really kicking off that communication over to patient financial services and the charge nurse. If it's not in the charge master, not in the materials management system, the item master file, to get those things documented correctly. And you can see huge gaps. If you audit your implant write-ups relative to your patient charges, you may just see some gaps relative to what was actually implanted in that patient and what that charge should be. relative to what was actually accounted for a charge for that patient account. And making the case for a centralized charge master process. With the SimplifyOR platform, we really assist you in implementing and maintaining a complete and accurate charge master file. SimplifyOR helps you improve revenue productivity by reducing rework. SimplifyOR also helps you improve your overall financial health by minimizing the inaccuracies in your existing charge master. The capture is complete and accurate from a clinical documentation perspective. Then at the end of the day, whether you're working with your payers, your implant vendors, or just looking at your case histories for implants, whether it's in your women's centers, EP, cath lab, or the OR, you want to see what was done by who and what the costs were and what the charges were. So SimplifyOR provides the connectivity against what was implanted into a patient, to the contract, to the item in the item master file, to the charge number in the charge master file, to ensure that every device that's consumed on the application for a patient account is assigned accurately into the patient's charges. And then making the case for a provider-driven implant write-up. Today you have 25 to 30 implant reps coming into your hospital, and whether it's your women's center, your cath lab, your EP, or your ORs, documenting cases, taking a picture of it, sending it to their distribution center for invoicing. So your circulating nurses and charge nurses and purchasing folks are tasked with disseminating information from 25 to 35 different implant reps, searching your item masters and charge masters to try to document cases correctly. So SimplifyOR creates a provider-driven standardized process across all implant vendors and networks. So if you're an IDN or an ACO with 15 hospitals underneath you, our platform allows you to standardize implant contracts across all your hospitals or surgery centers. We create the interoperability between your EMR, your ERP, and your vendor contracts. You gain point of use clinical and supply chain documentation, which in today's world, where we're looking to eliminate waste and gain efficiencies in the OR and supply chain, it's becoming more and more important. We improve the revenue cycle productivity by reducing the rework. And we improve the overall financial health by minimizing the inaccuracies of charge master information. We point to, and we're proud of the fact that in our platform, it has to be on the vendor contract for the implant, and it has to be associated in your ERP and your EMR for a charge number to flow through the process. If it's not, it'll simply be rejected. Then at the end of the day, if you want to review the utilization analytics, you have those off the back end of the web app for the hospital. This is just a quick screenshot slide of how we provide the interoperability between the EMR and the ERP and the vendor contracts. We'll go into this a little bit deeper in my demo here in just a second. And then SimplifyOR's implementation, along with working with Ransolve. We provide an implementation service for our platform that delivers a quick return on investment and ongoing benefits from using the software with expert consultation and effective implant business process design with the help of Ransolve. And that's it for this section of my presentation. What I want to do now is simply show you a quick demo of the application. So bear with me just a second. Okay, this is simply, we're an Apple platform. So with an iPad, an iPhone, or an iPod, you simply would allow your vendor reps a free download from the App Store. So the consumption can be done from vendor reps perspective or from a nurse's perspective. Today, for ease of use, I'm going to scan a case for a total knee arthroscopy as a circulating nurse. So let's go ahead and get started. So first I would click on new consumption. And then I would scan the the barcode on the patient's wristband. Okay, so in this case, we'll say it's patient number 1. We're going to perform a total knee arthroscopy. Stryker is the vendor we'll be using. We'll say Matt Smith is the surgeon performing this case. And we're in the operating room, so we'll click on 106 operating room. Tap next, and here's our summary information we just loaded. So we'll go ahead and save that right now. Alrighty, so we have our summary information or our header information for the case. As a circulating nurse, we just simply tap record and add. And then we go ahead and add the capitated number for the hospital's total knee arthroscopy. That collects the charge information and the cost information. Then we just simply go ahead and scan the QR codes off the sterile boxes of the implants. So let me go ahead and do that real quickly. Hang on here. So here we collect the GTIN code, the lot number, the date code, and what was used. If it was wasted, we would simply toggle wasted. But since it's not, we used it. So we'll go ahead and click save and add. And I'll just simply scan a couple more QR codes off sterile boxes for this total knee arthroscopy. Okay. So here we have it. In this environment, Dr. Smith just ran total knee arthroscopy. In the app, you can see the date of service and the time, which is critical for pushing that information back into your EMR for patient charges. We see the patient account number. We see the surgery type. We see the doctor or surgeon that performed this case. We see the contract expiration date for this vendor, in this instance, Stryker. It's really important. I wanted to show contract expiration date so that everybody would be in agreement on timing of new contract costs and such, okay? And then we have the department number that performed this case. And below it, you can see the manufacturer number or GTN code for that device, the lot number, the date code, the description, and the quantity used or wasted, okay? So that's the information we collect in the app, and it really provides a nice collection of data that we then curate within the hospital's SimplifyOR web app to then circulate it back into the hospital's EMR for patient charges and ERP for purchase order creation, and actually be able to send a CSV file to whoever wants it on the vendor rep side, whether it's the distribution center for replenishment and invoicing, or the vendor rep, or both perhaps, to have clean information that's submitted after a case is completed. So there's not arguments between contract costs and such information that happens daily now with manual processes. So as a circulating nurse, I'll just simply tap submit. And then we'll go back over to our dashboard here. It's just a simple dashboard where we do consumption in the consumption tab. And if it's completed, like the case we just did, we simply tap completed. And then we see we have the case here that we just done waiting for review. Okay. So this is the information that was collected on the app that again gets curated in the back end to be able to ensure vendor contract compliance and patient account charge compliance for the provider. So we'll just simply tap approve. And that's it. So in today's world where you're running around chasing implant write-up paperwork, this is really a paperless process. From a hospital perspective, it's literally one click and done to complete a clinical and supply chain documentation of a case. So let me go to our web app now and show you the information that's collected there. So I would just simply go to our analytics tab and do a date range. And this is the case that we just performed in the app. And I'll talk about it a little bit later about the servers, where this is stored and such. But the information that's collected now for an implant case, again, whether it's in the Women's Center, EP, Cath Lab, or the ORs, this is the type data you now have automatically at your fingertips as soon as a case is done in the app. So we collect the department number where the case was performed, the task or surgery type, the vendor that performed the implants, the physician or doctor that performed the case, the patient number from just a simple scan of the wristband in the OR. For date of service, we have the consumption time. We create a PO number for the vendor rep and for the hospitals. We have an electronic signature of the circulating nurse that performed the case and the vendor rep that performed the consumption in the app. In this case, you'll remember that I was logged in as the circulating nurse. So I did the consumption as the vendor rep and I approved the case as the circulating nurse. And then I also display on every page for every vendor the contract expiration date, which is very important. As contract expires at 12/59 or 11/59/59, if you have a new contract loaded in the web app, it simply picks up that new contract pricing for the next case, for the next day. And then below you see we have the collection of the manufacturer number, the GTIN code, which is becoming more and more critical today for tracking implants and becoming compliant with GUDI GS1 standards. We have the purchase item number from the materials management system. We have the charge number, the 440701 from the hospital's charge master. We have the description for those devices. We have the lot number and date code associated with those devices. Then we have what was consumed. If something was wasted, it would show in the wasted column. We have the hospital's charge amount. We have the hospital's contract wasted cost and the hospital's contract cost for the consumed devices. Okay. So what's real important going forward today for your surgery centers and your hospitals is the ability to collect and curate and circulate this data seamlessly. We can integrate with your EMRs and your ERPs to push this information into them automatically for patient charges, patient charting, and creating a PO in your hospital's materials management system. Okay. So next I want to go to another slide deck that just briefly goes over the application. So let me get back to my first slide here. Okay, so what we set out to do was solve the pain points in implant documentation, where today, if it's not in your implant vendor contract and not in your charge master or your item master file, it can be up to 23 touch points between 3 departments, your OR, your patient financial services, and your supply chain, to get that documentation correctly into your charge master to document a case correctly. And we all know the pain points associated with documenting an implant case correctly. And there's just many of them. So it could be for us, it was up to 23 touch points between 3 departments and 5 people having to touch that piece of paper: the circulating nurse, the charge nurse, patient financial services, somebody over in purchasing, and the contracts person over in purchasing. And this slide just simply explains that. The 23 touch points to get it right, to charge a patient correctly, over to what I call tech leadership, which is the future state of implant patient charging. which is really what we just talked about when I showed you the demo. Either the vendor rep or the circulating nurse can do the consumption in the application. The circulating nurse or the nurse would approve the consumption in the application when the case was completed. Then the hospital's SimplifyOR web app could automatically update a PO in the hospital's PO file. We can update patient charges in the patient account for patient billing. We can automatically update the patient's chart. We do have the technology to create and update an item in the item master file, or create and update the charge number in the hospital's charge master file. So we have two platforms. One is fully automated, one click and done. And the second version of our software is what we call charge master in, charge master out. So if that implanted device is not associated with a charge number in the hospital's charge master file, the app simply throws an exception. It cannot be approved until that implant is associated with a charge number in the hospital's charge master system. Once it is, that exception falls away and that case can be approved in the app. And this is really, from a revenue cycle perspective, it doesn't get any easier than this. As we just displayed in the demo, we simply scan the wristband to get that patient account. We add the devices into the app simply by scanning the QR code off the sterile boxes from the total knee or total hip. If it's a trauma case, we just simply type in the catalog number and you'd see the same type information. So if the vendor rep or the circulating nurse is done doing consumption on that account for that case, they simply submit it. The hospital charge nurse or circulating nurse would approve the case. And then you have the analytics off the back end, like I just showed you, relative to case histories. And again, we have the ability, whether it's version 1 or version 2, we have the ability to provide the automation to update the patient's charges in the patient account, update the patient's chart with the GTIN number and catalog number, what was used or wasted in the chart, and creating the PO in the hospital's materials management system. And this is the data that is the interoperability and the superiority, I think, of the SimplifyOR platform. It's just a simple scan on an app after the case is completed. There's no double keying at all. Once the devices are scanned into the application and the nurse approves it, we can then create the interoperability and automation into your EMR and ERP to update the patient account information. So your circulating nurses or your charge nurses or your patient financial services folks and your supply chain folks don't have stacks of implant write-ups on their desks anymore that they're feverishly trying to get completed the last day of the month for billing. With our platform, it's a completely automated process. So we eliminate all those manual steps. We eliminate all those manual implant write-ups from those 25 or 35 vendor reps that come into your hospital. And we simply provide you a provider-driven implant write-up process that's standardized to your rules as a provider, and the automation to be able to update your charges and charting and your PO information on your materials management system side. And this is just a simple slide that shows that. From the tray, we do an ORIF case, let's say, it's consumed into the app. And our integration is with the Epics and the Cerners or the Lawsons, PeopleSofts of the world. On our back end, you have the visibility now by surgeon, by vendor, by surgery type to be able to drill down into the what if scenarios from an implant vendor contract perspective, from a payer negotiation perspective, or simply just working with your surgeons to help reduce costs. You now have that data on one screen. And this is just a simple slide of the scale of the SimplifyOR platform. We're located on Amazon HIPAA secure Amazon servers in Portland, Oregon, with redundancy over on the East Coast. We're a Apple platform, and we provide, I think, real secure HIPAA compliant processes to automate and standardize your implant write-up processes that are really now driven by you and your rules as a provider, as opposed to vendor reps dropping off implant write-up sheets on desks and then trying to get through those and decipher those in a methodical process. We standardize it, we streamline it, we automate it so that you can collect, curate, and circulate implant data automatically, and then have the history to look back over time to see where improvements can be made. And this is just a simple slide of the bullet points. Feel free to email Raphael, and he'll share this slide deck or either slide deck with you. And again, I just want to thank Raphael and Ransolve for their time. I look forward to the partnership with Ransolve. I think there's a lot of opportunity, whether it's a surgery center or a hospital, to provide automation that really creates rules for the providers to manage their implant write-up processes. So Raphael, with that, I just want to thank you and send it on back to you.
Thank you, Jim. This concludes our webinar session. We both want to thank you for attending our webinar, Real-Time Surgical Implant Tracking. As Jim mentioned, if you would like additional information regarding this presentation and our revenue cycle management services, please visit our websites at ransolve.com or SimplifyOR.com.